Pharmacogenomics combines the science of genomics and pharmacology to understand the genetic basis of medication response. In a recent state-of-the-art review, Dr. Limdy, director of University of Alabama at Birmingham's Translational Pharmacogenomics program, and Dr. Davis, postdoctoral fellow in genomic medicine, discuss the origins and current status of pharmacogenomics in personalizing medication therapy based on insights obtained from individual and team investigative efforts. The authors highlight the importance of genetic underpinnings of response to commonly used medications in all areas of medicine, from cancer to psychiatry to cardiology. They also highlight the racial and geographically diverse patient groups studied, in contrast to randomized controlled trials or RCTs, to identify novel gene variants influencing drug response, and discuss differences in the prevalence of actionable variants by race. Pharmacogenomics has created the translational framework by integrating discovery, T1, translation, T2, incorporation into clinical practice, T3, and evaluation of real-world effectiveness, T4, for genomic medicine by providing a roadmap for seamless integration of research findings into practice. Using warfarin as an example, the authors demonstrate that the same gene variant, for example VKORC1, can have different impact by race or ancestry. Second, that failure to include race or ancestry-specific variants can do harm. Third, that gene outcome associations are phenotype-dependent. And finally, that evidence synthesis from varied sources, for instance RCTs and cohort studies, and sustained team science are vital in understanding and addressing racial differences and knowledge gaps. Next, the authors use clopidogrel as an example to highlight that documentation and adjustment for the baseline phenotype and confounders is vitally important. Second, that technological advancements can enable point-of-care genotyping, allowing feasible and scalable pharmacogenomic implementation. Third, that pharmacogenomic studies are addressing the lack of racial representation in the RCTs conducted to gain FDA approval. And finally, that the strength and consistency of gene outcome associations are similar across races or ancestries. To conclude, the researchers discuss race and ancestry in the context of the changing U.S. population and the need to identify novel and impactful variants to develop accurate and precise measurements of racial identity and integrate genetic granularity of ancestry enabled by advances in genomics. This, they argue, is vital in the quest to deliver race-conscious medicine.